Anne Arundel Medical Center is growing fast, capturing local and national attention, recognized as one of the leading hospitals in the Baltimore region, as one of the nation's top 100 hospitals for orthopedic care, and as one of America's best hospitals for pulmonary and women's and children's care.
It's not just a community hospital, it's clearly a regional center, and I think the care we provide is every bit as good as you can get at a very fine university center.
At Anne Arundel Medical Center, we've preserved the best of community medical care and combined that with the best that technology has to offer.
At Anne Arundel Medical Center, all of the teamwork, all of the superior care is still delivered one patient at a time. In early 2001, Stephanie Caruso was one of Anne Arundel Medical Center's many patients.
They informed me that there was a chance that Stephanie would not make it.
Until now, Stephanie Caruso had never had a major health problem. The birth 2 years earlier of Stephanie and Tony's first child, Lillian, was without complication.
She did.
You did, didn't you?
However, during her second pregnancy in the fall of 2000, Stephanie was diagnosed with placenta previa, an abnormal but not uncommon positioning of the placenta over the cervix that can cause severe hemorrhaging. Then, January 21st, 10 weeks shy of her due date, Stephanie hosted a family party.
About 8 o'clock that evening, everybody left. 11:45, Stephanie woke up and she was bleeding very bad, hemorrhaging very bad.
By 12:15 a.m., when Stephanie and Tony arrived at Anne Arundel Medical Center, the operating room and staff were ready to go.
Given the diagnosis of placenta previa of Stephanie, we had planned on doing a cesarean delivery.
We got a call from the operating room saying that they had an emergency situation and that they needed blood very quickly. We then very quickly got a sample from her and then were able to provide O-positive blood for her.
5 minutes later, Stephanie's baby was born.
So I heard somebody say, "It's a girl." And I looked down at Stephanie and I said, "Honey, we have another baby girl." And she smiled back at me. And that was the last look that Stephanie gave to me.
Tony actually called me and said, "Dr. Wallman, something's wrong." And I looked over and Stephanie was not awake and alert and talking anymore.
Stephanie had suffered a rare complication, amniotic fluid embolism, that sent fluids from the birth sac into her bloodstream.
It was very unexpected, and that's the nature of amniotic fluid embolism. At that point in time, her blood pressure was 50 over nothing.
Typically in amniotic fluid embolus, a woman will experience a fatal outcome.
This is the kind of event that an obstetrician gets to see maybe once during their career, and once they do, they hope never to see it again.
Traditionally, the only way to diagnose an amniotic fluid embolism was post-mortem in the pathology laboratory. It took a long time to sort through all the other more common possibilities, seeing the heart rate go down, then after treating that, seeing the blood pressure go down, after treating that, then seeing the saturation, and that's what really keyed me in that this was a problem involving the pulmonary system.
Once stable, Stephanie Caruso was transported to the intensive care unit. En route, she experienced another complication called DIC, disseminated intravascular coagulopathy, or excessive bleeding because of the inability to clot blood.
We basically had to protect her airway. She had stopped breathing. After that, what we did was put her on a ventilator.
Mrs. Caruso took 10 units of red cells, which is pretty much an entire body exchange. DIC is the most demanding of the blood bank emergency situations. You're pulling frozen products and thawing them. You're pulling platelets off of a rotator and pooling them and trying to get them ready for transfusion. You're trying to do the emergency cross match of the red cells, and you're moving pretty fast.
They told me that there was a chance of death and there was a chance of life as well.
We were able to keep her vital functions going. We were unsure initially as to how much neurologic recovery she would have. In other words, was she going to wake up or not?
I was scared she was going to die. I had a patient 19 years ago with the same she had an amniotic embolus 19 years ago, and I lost her.
I told the family, quite frankly, that it would be 2 or 3 days before we'd know what was going to happen to Stephanie, even though she'd been in the right place in the operating room at the right time.
Meanwhile, Stephanie's baby was taken to the neonatal intensive care unit, known as the NICU.
She was breathing on her own and was pretty vigorous. She needed a little bit of assistance with oxygen.
The thing that he asked us most to do, along with care for his baby, was to pray for himself and for his wife. And he had a little daughter at home whose leg was in a cast, and so he just didn't know where he should be, but he felt comfortable with leaving his baby in our care, which meant a lot to us.
The nurse was there with me, and she said, "Your baby is fine, your wife is not. Go be with Stephanie." I was trying everything to bring Stephanie back to me, to us. I told her that I was going to name our baby this real long Italian name, and I told her that I was going to paint the basement real dark brown, and she frowned at me, so at that point I knew she was in there.
Contrary to all expectations, Stephanie Caruso woke up early Monday morning, just hours after her surgery.
She looked at me, and she asked me what I was doing there, and I said I was taking care of her. Then she said, "Why are your eyes so red?" I said, "It must be allergies." She was holding my hand and she said, "I love you." And all I could do was try not to cry.
But just when it seemed they had beaten all odds, a call came for Tony. His baby's lung had collapsed.
And as the mom was starting to get a little better, the baby actually took a turn for the worse, so did need very intensive care while the baby was here.
On the second day of life, she had a tear in her lung, which we call pneumothorax. That's not uncommon in a premature baby. We're able to put a small tube in the side of the baby. It gets that extra air out and allows the lung to heal.
Back in the ICU, Stephanie's physical health slowly improved over the next 2 days. Stephanie herself remembers virtually nothing of her ordeal.
The worst part of not remembering is having my baby. I just don't remember it at all.
When every hour passed, she didn't remember the past hour. When we were finally moved out of the CCU back to the Klatenoff Pavilion, we went and visited our new baby daughter 5 times for the first time.
On February 28, 2001, over a month after her emergency cesarean, Stephanie was finally able to bring her newborn, whom she and Tony named Angelica, home. More than 30 people had been directly involved in saving their lives, and dozens more helped them fully recover.
Certainly she had her age on her son, but what really I think made the difference in the long run, and the biggest difference was the teamwork that was available at Anne Arundel Medical Center to try to get the best result possible.
You couldn't possibly get a good result like this unless everybody did come immediately, do their job professionally, and work well as a team. So it wouldn't have even been possible if we didn't have the group of people that we have here.
Well, I wouldn't practice anywhere else. It should be a reassurance for patients to know that if they come here, they're going to get the best care possible.
And I wish I could remember everyone that helped me personally, but I can't. There's just no words that could thank them enough that they helped me get through what I went through. And without them, I definitely wouldn't be here.